I'll be a nurse practitioner.
Okay, cool.
Can you tell me why you're here today?
I'm here to just get a physical for work.
Okay, perfect. And can you tell me how old you are?
I am 31.
Okay, awesome. And what do you do for work?
I work in TV. I work with Fox Sports Detroit.
Okay, cool. And how many hours a week do you usually work?
Like 40 or so.
Okay. And what shift do you normally work?
I normally work like mid to late day, 1 to like 11.
Okay, perfect. And then before I get started, do you have any like concerns while you're here? Anything that's been bothering you?
No.
Okay. So first I'll just ask some questions and I'll do an assessment, okay?
Cool.
Have you had any like previous hospitalizations or surgeries in the past?
No.
Okay. What about any trauma or illnesses?
Nothing.
Okay. Have you had any like occupational illness or injury at work?
No, nothing at work.
Okay. Do you have any chronic medical conditions like diabetes, asthma, alcoholism, cancer,
No.
hypertension? Okay.
Nope.
Good. Does anyone in your family have any of those things?
No.
Okay. None of your mom or dad or grandparents?
Nope.
Okay, good. Do you have any history of like suicidal ideation or any mental illness in the past?
Nope, none of that.
Okay. Any history of like substance abuse disorder or anything like that?
Nope.
Okay. Have you ever had any, well, where do you live at right now? Who do you live with?
I have my wife and my son and my 2 dogs.
Okay, you just live in a single family home?
Yeah.
Okay, perfect. Are you sexually active?
Yeah.
Okay, how many partners in the past year?
Just one.
Okay, do you, use any, like, form of birth control?
No.
Okay. And then, how do you identify, like, as a male or female?
Male.
Okay. All right, and then I'll ask you just about, like, some things going on now. Do you take any medications every day?
No. Just like vitamins, but
What vitamins do you take?
just like a daily vitamin.
Okay, perfect. And then, are you up to date on all your immunizations?
Yeah.
Okay. You got the flu shot this year?
Yep.
Okay. Do you drink alcohol at all?
Occasionally, but not that much.
How often would you say you drink?
Probably like once every other week.
Okay. In just 1 or 2 drinks, or how many drinks? Okay.
Just a couple drinks.
Okay, perfect. And then, do you smoke or use any form of tobacco, vape, chew?
No.
Okay. Do you use any illicit drugs?
No.
Okay. Do you exercise every day?
I try to 3-4 times a week.
What do you do when you exercise?
Normally I just like run or work out for half hour.
Okay. And then, what's your diet like?
Normally my wife and I cook a lot at home. We try to eat healthy.
Okay.
Vegetables, fish.
Do you drink any caffeine?
1 cup of coffee a day, yeah.
Okay, and then how much sleep do you get a night?
6-7 hours.
Okay, do you feel well rested?
Yeah.
Okay, good. So now I'm just going to ask you about if you've had any symptoms, and just tell me yes or no. And if you have any questions about anything, you can ask me at the end, okay?
Okay.
Have you had any like weight gain or loss, or any weight changes or fatigue?
No.
Okay, what about any like headache or dizziness?
No.
Okay, any like eye redness or dryness or
No.
blurred vision? Okay. Any earache or ear pain or
No.
okay, no drainage out of your ear?
No.
Okay, any nasal congestion or bloody noses?
No, none of that.
Okay, what about any like mouth sores or like trouble swallowing, anything like that?
No.
Okay, any sore throat, hoarseness in your throat?
No.
Okay. Any like heart palpitations or chest pain?
No.
Okay. Any cough or difficulty breathing?
No.
Okay. Any like trouble urinating or like starting the flow of urine or pain with urination?
Nope.
Okay. Any nausea, vomiting, or diarrhea or constipation?
No.
Okay. So bowel habits have been normal.
Yeah, everything's fine.
Okay. Any joint pain or stiffness or warmth or redness?
No.
Any muscle pain?
No, everything's fine.
Okay. Any lightheadedness or dizziness? No?
No.
Okay. Any like suicidal ideation or like thoughts of harming yourself, or any depression or anxiety?
No. No.
Okay, good. Any like increased thirst or hunger or weight gain or loss?
No.
Okay. Any easy bleeding or bruising?
No.
Okay, good. So everything's been good. No
Yeah,
symptoms.
everything's fine.
Okay, perfect. Well then I'll start my my assessment now. So I'm just gonna review your vitals, which looked good. And then I watched you walk in the room. You looked like you were walking fine. You don't use any assistive devices.
Yep.
So the first thing I just look at is like how you're sitting and how you're dressed, which you're dressed appropriately. You look your stated age. You look like you're not in any distress, not disheveled.
Yep.
Your body stature, you look like you're pretty athletic. No like signs of malnourishment. Your behavior's, content. You seem happy. You don't seem depressed or anxious. No flat affect or labile or anything like that. Okay, and then so then I'm gonna move on. Have you had any like increased confusion at home or anything like that, like forgetfulness?
No.
Okay. Can you tell me where you're at right now?
Yeah, I'm in the doctor's office.
Okay, and what month is it?
It's April.
Okay, and what year?
It's 2020.
Okay, who's the president?
Donald Trump.
Okay, perfect. So your thoughts are coherent and your alert and oriented times 3. Okay. Lou? No. Okay. Alright, so next I'm going to do is I'm going to look at your head and your scalp and your face.
Okay.
First thing I'm just going to do is inspect so your face is symmetrical. You don't have any like involuntary movements or muscle twitches, no lesions or anything like that. So then I'm going to look at your scalp. Okay, no lesions. Just going to feel your scalp. Your head is normal cephalic. Okay, and then while I'm up here, I'm just going to look at your hair distribution. You have medium texture, normal distribution throughout. Okay, perfect. Then I'm just going to move down to your face. I'm just going to feel, do you have any pain when I touch anywhere on your face right here?
No.
Okay, so just checking your sinuses. They're non-tender. Okay. So then I'm gonna go to your eyes next. Can you just follow my
Sure.
light with your eyes only? Okay, good. EOMs are intact. And I'm just gonna shine this light in your eye real quick. Okay. Pupils are equal, round, reactive to light. Okay. And then can you look over my shoulder? Okay, and then look back at this light. Okay, so equal, round, reactive to light and accommodation. Then I'm just gonna look at your eyes. I'm gonna pull down your conjunctiva are pink, your sclera are white. No redness or drainage or tearing, anything like that. Your eyebrows and eyelashes are normal distribution and texture. So I'm going to go to your ears. I'm just going to look at your mastoid bone. I'm going to palpate it. Look at your pinna and your tragus. Any pain when I'm touching anywhere like that?
No.
Okay, we'll do the same on the other side. Okay, your ears are symmetrical and intact. There's no lesions or deformities. At this point, I would look in your ear with the otoscope to look at your tympanic membrane. Make sure it looks pearly gray. There's no bulging or erythema or drainage. I could see the cone of light in the inner ear is visible. And I'll do that bilaterally. So then I'm going to go to your nose. I would also use the otoscope here to look up your nose, but I'll just use my pen light. First I would look and make sure your septum is midline, which it is. There's no deformities or drainage, lesions, anything like that. And I'll look on the inside. Okay, no drainage or swelling or blood. Your turbinates are pink. Septum is midline, no polyps or any drainage. Can you take a deep breath? Okay, and this side. Okay. Airflow is good through both nostrils. Okay, next I'm going to move down to your mouth. So I'm going to look at your lips. They're symmetrical, intact, no cracking or lesions. Can you open up? Okay. Just going to look at your oral mucosa, your buccal mucosa. Your dentation is aligned and intact, no missing teeth. No lesions on your tongue, everything is pink with no lesions or erythema. Can you stick your tongue out for me and say ah? Okay, your oropharynx is pink, your tonsils are 2+ with no drainage, your uvula rises symmetrically in the midline. And then can you stick your tongue out and move it back and forth? Okay, good. Okay, so I was just assessing cranial nerve 9 and 10 there. And then if you could for me, can you go like this with your neck? Okay, can you turn it like this? Okay, and then lateral like that. And then up and down. Okay, cervical spine and range of motion is good. No pain or tenderness in your neck back here?
No.
Okay, good. That's cranial nerve 11. I was assessing that. And then push up against my hands with your shoulders. Okay, good. All right, now I'm going to look at your neck. I'm going to first feel to see if there's any swollen lymph nodes. So it's pre-auricle, post-auricle, occipital, posterior cervical, anterior cervical, submandibular, or tonsillar, submandibular, submental, and then subclavicular. No swollen lymph nodes or anything, pain or tenderness or anything like that when I press anywhere?
Nope.
Okay. Everything looks good, so I'm just going to look at your neck. Okay, trachea's midline. I'm just going to try and feel your thyroid, so can you swallow for me? Okay, and the other side. Okay, good. So your thyroid is soft and symmetrical bilaterally, no nodules or hardness or anything like that. Then I'm just gonna look at your veins in your neck, your jugular vein, look for any distension. Can you turn your head for me? Okay, now the other side. Okay, good. And then I'm gonna feel your carotid arteries. Okay, good. No thrill, 2+. 2+ bilaterally, no thrill. I'm just going to listen to them in your neck if you don't mind. Okay, just hold your breath for me. No bruit is heard in your carotid arteries. Okay. So next I'm just gonna move on. I'm just gonna look at your chest and your thorax and listen to your lungs. Before I would do that, I would also assess your hearing by doing the Renee or Weber's test with the tuning fork to assess for any sensorineural or conductive hearing loss. Okay, so I'm gonna move on and do your chest and thorax and lungs. Your chest ratio is 2:1, your AP chest ratio. Can you just turn for me this way? Okay, can you take a deep breath? Okay, good. Your symmetric chest expansion, go ahead and sit back. Okay, any pain when I'm touching anywhere?
No.
Okay, no pain on your back when I'm touching?
No.
Okay. Can you say 99 from you?
99. 99. 99. 99. 99. 99.
Okay, no tactile fremitus heard or felt?
No.
Okay. Alright, I'm just gonna hit on your back with my fingers, okay?
Okay.
Resonance is heard over all lung fields. I'm just going to do the same thing on the front. You didn't have any pain when I hit you like that?
No.
Alright, I'm going to lift it up this way. Can you sit forward for me again? Just
Yep.
a little bit? Right there, okay. Alright, tell me if you feel any pain, okay? When I do that.
No pain.
Okay, good. That's, no coaster vertebral angle tenderness. Alright, I'm just gonna listen to your lungs. Take a deep breath in and out for me, okay?
Okay.
Alright, go ahead. Okay. I'm just gonna listen to the front now. Do the same thing. One last deep breath. Okay. Lungs are clear. No diminished lung sounds anywhere. Or any adventitious breath sounds. Okay, I'm gonna go on now and listen to your heart. Just gonna look at your chest wall. You said there was no pain or tenderness when I palpate. Okay, no deformities on the chest wall or anything like that. Chest wall looks symmetric. Okay, I'm just gonna have you sit still for a second. I'm gonna listen to your heart sounds. Okay, can you lean forward for me? Okay, good. Okay, I was just having you lean forward to listen for any murmurs, but I hear S1, S2 heart sounds. No clicking or murmurs are heard. Regular rate and rhythm. Next, I'm just going to look at your extremities. Everything feels warm. I'm going to look at your nails. Cap refill is less than 3. Normal hair distribution. No areas of coolness or change in color, skin color anywhere. Okay. Same as on your legs. Normal hair distribution. The legs are warm. No discoloration or redness anywhere. Just going to look at your toes real quick. Okay, cap refill is less than 3 seconds. Okay, I'm just going to feel your dorsalis pedis pulse. Okay, 2 plus. I'm going to feel your posterior tibial pulses. Those are also 2 plus. And feel your radial pulse. 2 plus. Your brachial. 2 plus. Good. And then can I have you laid on your back for me, please?
Sure.
Okay. I'm just going to feel your femoral pulses. And then your popliteal pulse. You can bend your knee for me a little bit, like that. Okay, and then this one. Good. Pulses are 2 plus and symmetric and bilaterally. Okay, so now I'm just gonna look at your abdomen. Whenever you stay like this, okay?
Okay.
So first thing is I'm just gonna look at your abdomen. It looks symmetrical, no protuberances, or herniations or bulging anywhere. It looks soft. umbilicus is symmetrical, normal hair distribution, skin color. Okay, I'm just gonna listen to your vowel sounds, okay? Positive active vowel sounds in all 4 quadrants. I'm gonna keep your shirt up, sorry. Okay, I'm just gonna press on your stomach. You tell me if you have any pain, okay? Well, first I'm just gonna, I'll tap on it and then I'll press on it, okay? Okay. And your tympani throughout and just appropriate dullness where the liver border would be. So now I'm just gonna press, tell me if you feel any pain, okay? I'm just gonna do light palpitation. I'm gonna do deep palpitation. Any pain?
Nope.
Okay. No masses or no masses or any deformities felt. I'm just gonna feel your liver. Can need you to lay the other way though. I'm sorry.
Okay.
With your legs maybe that way.
Okay.
Sorry. Okay. Take a deep breath in. Any pain when I'm doing that? Okay, I'm just feeling your liver. No hepatomegaly. Okay. And I'm just gonna tell me if you have any pain. I'm gonna press down and let go. Just gonna check for any rebound tenderness, check for any appendicitis. Tell me if you have any pain when I let go, okay? Any pain?
Nope.
Okay. Then I'm gonna check Murphy's sign. This is up here for your cholecystitis I'm gonna assess for. So tell me if you feel any pain. I'm gonna press on your gallbladder, okay?
Okay.
Any pain?
Nope.
Okay. And then I'm gonna have you push up with your leg and I'm gonna push down. Tell me if you have any pain in your right lower quadrant. This is also assessing for appendicitis. It's your ilio-psoas test.
Okay.
Any pain in your lower abdomen right here?
Nope.
Okay, good. All right, okay, you can sit back up. All right, last thing I'm gonna do is look at your joints. I'm just gonna feel all your joints, see if there's any redness or swelling or warmth over any of the joints. Any pain or tenderness on any of your joints? No?
Nope.
Okay. All right, the joints feel good, no redness, warmth, or tenderness. Okay. I just want you to take your arms and push against my hands. Okay, can you pull back? No, just pull, like, flex your arms. Okay, good. Okay, can you push your arms out against my hands?
Okay.
Okay, now push them in. Okay, good. Can you lift your leg up? Okay, and push down. Okay, and the same over here. Okay.
Thank
All
you.
right, can you push against my hands? Okay, now pull back. Okay, and then push against my hands with your feet and pull back. Good. Okay, and then push your knees out. Okay, and push them in. Okay, good. All right, so muscle strength is 5 out of 5. Symmetrical, upper and lower extremities. Okay, I'm just gonna check your range of motion. So can you lift your arms up? Okay, and down, abduction, adduction. Okay, can you go forward and down? Okay, flexion and extension. And can you go like this, internal rotation, external rotation? Okay, perfect. Okay, now I just want you to straighten your leg and then,
Both of them are.
yeah, both is good. And then put them down. Okay, and then can you move your hands like this? Okay, can you flip your palms like that? Okay, perfect. And you can go in and out like that. Okay, good. Can you lift your leg up? Okay, and down. Same. Okay, and then can you put your legs out? Okay, and in. Okay, good. No pain with any of that?
Nope.
Okay, good. Last thing I want you to do is move your foot back and forth like that. Both sides. Okay, good. So good range of motion, full range of motion, no pain in any of the joints. Okay, just gonna go here. Oh, one thing I want to do is, can you do this? I just want to check to see if you have carpal tunnel by checking the Phelan sign.
Sure.
You feel pain? No, nothing?
Mm-mm.
Okay. And I'm going to do the Tinnell's test. Do you have any pain when I press down right there?
No.
What about over here?
No.
Okay, good.
No, that's fine.
Okay, awesome. So I'm just going to check your reflexes now. First thing I'm going to have you do is just relax your arms here. Just relax. You got to totally relax. Okay. Check this side. Totally relax your arm. Okay. All right. Relax your arm here. Totally relaxed. Okay. Okay. Relax your arm. Just relaxed.
Yeah.
Okay. Okay. All right, then sit back. I'm just gonna check your knee reflexes. Let me see. Okay, perfect.
Ooh.
All right. Okay. 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 All your reflexes are 2. No hyperreflexia. Okay. I'm just gonna have you do a couple of things with your hands.
Okay.
Can you go like this back and forth for me as fast as you can? Okay, good. And then can you go like this? Touch each finger. Perfect. Go a little faster if you can. Perfect. Okay. Now I want you to touch your nose and then touch my finger, okay? Okay, good. Perfect. Then I want you to, can you press your toes down like a gas, you're hitting a gas pedal? Keep going. Okay, good. Can you make an 8 with your feet?
Like that.
Yeah, or like just with your ankle, kind of. Yeah, good. Perfect. Okay. All right, can you stand up for me? Can you hop on one foot? Okay, can you do the other foot? Perfect. Okay, can you just walk that way for me? All right, and come back. Okay, good. Your gait is normal. Rapid alternating movements are normal. Any pain when I touch your back like this?
No.
What about down your spine like that?
Nope.
Okay, can you bend all the way over? I just want to feel for alignment of your spine. Okay, spine is midline. Okay, come on up. Checking flexion, extension. Can you turn like this for me?
Yeah.
Okay, and then what about laterally like this? Okay, good range of motion. Okay, I'll have you sit down for me then. I'm just gonna have you close your eyes and tell me what item I'm putting in your hand, okay?
Okay.
Alright. Tell me what that is.
Pen.
Good job. Okay, and then I'm gonna trace a number on your palm. I want you to tell me what number it is, okay?
3.
Okay, good. So you're able to identify the object and the number that's drawn on your palm. Okay, and then the one other thing I want to do is I want you to tell me you can open your eyes for now.
Okay.
I'm going to either touch you with this dull side or this sharp side. I want you to tell me if I'm touching you with dull or sharp, okay?
Okay.
Okay, so close your eyes.
Dull.
Okay.
Sharp.
Okay.
Dull. Sharp. Dull. Sharp. 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 dull.
Okay, good job. So
Sweet.
you're able to, feel there's no sensory deficits or problems. Okay. I think that's all I have to do.